Hello, Mrs. Hines. My name is Daniel Polana, and I will be your genetic counselor for today. Now, I understand that you have gone to your doctor due to your symptoms in which you have felt extremely nauseated and had horrible headaches. And most recently, you've become extremely sluggish, and your legs and arms feel like they have weights attached to them. I know also that your doctor noticed a slight droop in your left eye, and after many rounds of tests, they have discovered that you have Kearns-Sayre syndrome. I understand that you want to know how your condition will end up affecting your children also. Now, first of all, I just want to say I know this is a lot to take in all at once. I know understanding learning that you have this syndrome and know having all these things you have to do, it can be really stressful. And I want you to know that I understand that, and all I'm going to do here is give you all the information that I have and try to make it as easy for you to understand so you know everything you can do in this situation. Now, to start, I'm just going to go over a description of Kearns-Sayre syndrome so you understand completely what's happening. And basically, what's big about this is that it's a mitochondrial disorder. Now, the mitochondria, which is shown here on the left side, is a organelle which is inside of your cells. Mitochondria is the part of your cell that results in the energy that's given, and specifically on a medical standpoint, what's happening inside of the mitochondrial DNA here, which is where it's happening, with that circle in the red area, you can see that that's where it's happening inside of the DNA. A deletion on a certain gene called the RRM2B gene is responsible for, which that gene is responsible for producing enzymes which speed up the reactions of the production of DNA. And whenever this deletion happens, the DNA is not able to synthesize or produce as quickly. And one of the bigger things about this whole syndrome is that since it is a mitochondrial disorder, the genes will be passed down from the mother to the child. Now, as for the problem created specifically, I'm just going to reiterate what I just said, in which that certain gene encodes for a reaction that is necessary for DNA synthesis, which is the production of DNA. And when this gene is inhibited or stopped or slowed down, it does not occur properly, leading to large-scale effects such as the symptoms that you are seeing. And this can lead to difficulty seeing, drooping eyelids, weaker paralyzed eyes muscles, but it can also extend past just your eyes and go to even parts of like your heart and your cardiovascular system and even your different limbs and stuff, due to the mitochondria being the dealing with the production of energy. It can do that in many different forms and lead to things such as the eye droop that you see here and to this person right here. Now, the big thing here is with this pedigree that I've created to show you the maternal line of inheritance that I was telling you about earlier. So basically here we see that you have the Kearns-Sayre syndrome, and it's not 100% chance that all your children will get the syndrome due to it being rare that it is inherited. So that's one thing you can kind of feel relieved about, is that it isn't very common for it to be inherited, but if it were to be inherited, it would be coming directly from you. And even if the father does have the disease, he would have, or not the disease, the syndrome, sorry, he would have no part in the inheritance of that syndrome to your children. But usually it is a mutation that occurs that causes this syndrome, so that is something that you can kind of feel relieved about. Now, along with that, because I know you were asking about how it can affect your children, I know there's some more frequently asked questions that I can answer. Now, sadly, there isn't a cure for Kearns-Sayre syndrome, but early detection and supportive care can help reduce the risk of the complications that occur. Now, your healthcare provider can recommend therapies to you or your child to help manage your symptoms and just overall live a better quality life. As for reducing your child's risk of developing Kearns-Sayre syndrome, there's no way you can prevent Kearns-Sayre syndrome and no way you can cause Kearns-Sayre syndrome. It's more due to a random genetic mutation in the mitochondria, or maybe if it's inherited, but usually it's a mutation, as I said earlier. And these mutations happen as the baby develops in the womb. And if it is inherited, as I said before, it's a maternal line of inheritance. Now, as for when you should seek care for your child, as early as possible is the best you can do. If you can be able to reduce the risk of complications in any way, early testing is something that you can always do to be able to see and make sure that everything's either going all fine or what you need to do to make sure to stop those symptoms. Now, you can genetic testing can confirm a diagnosis, so you can receive your child can receive the appropriate care as well as you, and your healthcare provider can work with you to make a goal that matches your needs. As for case recommendations, things not resting recommendations really, but rather options. One thing is carrier screening, which is a genetic test that identifies if someone has a change or variant that can impact their children. Now, as you know that you already have the syndrome, this would not be as helpful as it would just be reiterating information that you always know. But just to give you all the options, we include this, and this is an option that you can take, and we don't discourage you from taking. The next thing you could do is consult with your cardiologist, who is a physician who's an expert for care of the heart and blood vessels. Now, this would be really good as it can help if those symptoms that we talked about earlier with the heart, or if the cardiovascular system, which is your blood and your veins, if anything were to happen there, your cardiologist would be able to be the best person to help with that and treat your symptoms and overall help you live a better and more quality life in this situation if you were to have any cardiovascular problems. Now, I understand that this is very difficult to hear and probably deal with, and just letting you have all the options so you can know any potential action you could take. Thank you for coming today, and I hope you have a great rest of your day.